Hello everyone, I am Dr. Prachi Kulkarni, Fertility Specialist, Ferty9 Fertility Center, Banjara Hills. March is Endometriosis Awareness Month. So let us discuss what is endometriosis, what are the symptoms of endometriosis, and what could be probable treatments of endometriosis. So endometriosis is a condition where a tissue which is similar to endometrium is implanted at different organs, and because it is hormone sensitive, every time you get periods, the bleeding will happen at all the places wherever the endometriosis is implanted. So these bleedings can cause swellings, it can cause adhesions, and the symptoms are related to the sites where all it is implanted. So, the first and most common symptom of endometriosis is period cramps or dysmenorrhea. Usually, period cramps are regularized. If you are having periods, you are supposed to have pain is what is considered, and it is considered as normal. But period cramps may be a symptom of endometriosis. So, please do not regularize period cramps. Consult your gynecologist to rule out endometriosis. So, why period cramps happens is because this endometrium-like tissue, if it is going deeper into the layer of the muscle, then something called as adenomyosis is developed in the wall of the uterus. So whenever there is adenomyosis, that uterus, when bleeding happens or if it contracts, you will have period cramps or severe pain during periods. So this is the first symptom of endometriosis. Second symptom of endometriosis is having heavy menstrual bleeding. Because of multiple reasons, because of inflammatory changes, because of adenomyosis, endometriosis patients usually tend to have heavier period flow. Third symptom of endometriosis is related to the adhesions. The adhesions which are causing the organs to stick together, like urinary bladder is sticking to the uterus, or the rectum is sticking to the uterus, the tube is changing its position and going behind the uterus, getting stuck there, the ovary is stuck to the uterus. So what it causes is frozen pelvis. So because of this condition, the patients usually will have chronic pelvic pain. So chronic pelvic pain which is present even without periods is related to endometriosis. The same reason of adhesions is responsible for the fourth symptom of endometriosis, which is pain during intercourse. So whenever the patients try to have intercourse, usually endometriosis patient, because of these adhesions, will observe deep pelvic pain or abdominal pain at the time of intercourse. So these are the different symptoms of endometriosis. So also it is possible that endometriosis can be present silently without any symptoms. So if somebody is suffering from infertility or unable to conceive and there is no obvious cause for infertility, then that patient also we advise to investigate for endometriosis, because this is known as a silent condition, because there might not be any symptoms of endometriosis though the disease is still present. So other symptoms, what can be the symptoms of endometriosis is if the endometriosis is implanted into the urinary bladder, or if the bladder is involved in endometriosis, there might be bleeding in the urine or pain during passing urine when you are having periods. Also, if the rectum is involved in endometriosis, there might be pain while passing motions or even blood in the stools at the time of your periods. So these are different symptoms of endometriosis. So what can be the possible treatment of endometriosis is, it can be either medical management related to the symptoms, or it can be surgical management. So in medical management, usually we advise to take some painkillers during periods. We also give tablets to control the heavy menstrual bleeding. We need to suppress the endometriosis if you are not planning pregnancy, so that it will not become severe and cause further complications. So there might be some hormonal medicines which may give. They might be in the form of oral tablets or sometimes even in the form of injections, which are hormonal injections, depot preparations, which are active for 1 to 3 months. So this is temporary suppression of endometriosis. So some patients may also require surgery for endometriosis, but we advise surgery only to those patients who have very large endometriotic cyst or who have very severe symptoms and they are not responding to the medical management of endometriosis. Usually, surgery should be done by an experienced endometriosis surgeon who can manage the condition very well, because this surgery is a difficult surgery because of the adhesions where the organs are attached to each other, and there might be a risk of damage to these organs, or sometimes even incomplete surgery if we are not able to separate the organs properly and we are not able to remove the disease completely. So it is always advisable to, if at all you need surgery, to get yourself operated from the most experienced surgeon who is experienced in the endometriotic surgeries. Also, whoever is planning for pregnancy, or even if you are not planning for pregnancy and you have endometriosis, it is better to consult a fertility specialist to know your options of fertility preservation, because endometriosis causes infertility because of multiple reasons, and it can be a progressive condition where as the time advances the complications might increase. So what we advise is, if you are not married and if you are having endometriosis, then you can consult your fertility specialist and you can consider about the option of egg freezing, or you can consider the option of suppressing the endometriosis until the time you plan your pregnancy. So how the endometriosis causes infertility is, it can affect the tubes, it can block the tubes, it can cause hydrosalpinx, which is accumulation of fluid in the tube, it can cause hematosalpinx, which is blood accumulation in the tube, making the tubes non-functional so that egg and sperm cannot meet in the body. Second way how endometriosis can affect fertility is if there are ovarian endometriomas. These ovarian endometriomas are also called as chocolate cysts. So these endometriomas can cause local inflammation wherein the egg quality of the other eggs in the ovary gets affected. It can also prevent ovulation and can cause multiple cysts in the ovary and leading to further increase in the disease. It can also affect the egg quality wherein there might be a risk of miscarriages even if you conceive, or it can also affect the egg reserve, where we see the egg reserve drops earlier in endometriosis patients. So what next is the reason for infertility is adenomyosis. It can be the swelling in the uterus which is preventing the implantation. If the adenomyosis swelling is very huge, it can also lead to miscarriages, and these are the multiple reasons why endometriosis results in infertility. Also, because of adhesions, the tube may not be in its position, so tubo-ovarian relationship is disturbed, the tube is kinked or bent or got stuck to the uterus, then after ovulation, the tube may not be able to pick up the egg. Also, the endometriosis affects the sperms which are present in the reproductive tract, affecting their motility, and it can also affect your fertility. So these are the different ways the endometriosis can affect fertility. So if you have endometriosis, then you should consult a fertility specialist as early as possible and plan your pregnancies early so that you can conceive either with IUIs, or you can also consider the option of going for IVF. So endometriosis patients usually are advised to progress with the ART treatments like IUI or IVF earlier than the other patients, because after the disease progresses, the complications may increase in case of endometriosis. Hope this was helpful. Thank you.